and there's a couple members who I haven't met before, so I wonder if we could do introductions. If that seems okay. And do we have is the YouTube going, Jay?
Yes, is everybody comfortable being on the record and recorded?
Yes.
Okay.
Yes.
Yes.
We are live and recording.
Great. Thank you, Jay. I can start introductions since I'm rambling anyway. And then maybe we can all just call the tiles as I see you on my screen. Is that okay for folks? Okay. So welcome to Multnomah County Animal Services October Community Advisory Committee. I am Erin Grayheck, and I use she and her for my pronouns. And I am I have transitioned from the interim director of Multnomah County Animal Services to this is honest to goodness my job, director of Multnomah County Animal Services. And I am super happy to be with you all and begin this journey together. And can we go to Christine?
Hi there, my name's Christine Getman. I use she, her pronouns. By day, I work for the Oregon Health Authority, and in my free time, I run a nonprofit that promotes inclusion and self-expression for kiddos with disabilities called Magic Wheelchair. We actually just opened our first brick and mortar location in downtown Gresham, so excited to be here and learn more about you, Erin. Thank you.
Great. Thanks, Christine. Welcome. Nice to see you. And Jonathan.
I'm Jonathan. I think you know, I've met a couple times. I'm currently the chair of this committee. I'm also volunteer leadership for Oregon Humane Society, and I am a former / on break volunteer from MCAS, as well as several other animal organizations.
Thank you. Megan?
Hi, my name is Megan Turvey. I've been on this board for a couple of years. I forget when COVID all kind of blurs together, but in my spare time, I work in healthcare administration, and I also volunteer at an animal shelter in town called Animal Aid, where I've been involved for 7 years or so. So excited to be a part of this as always.
Great. Thank you, Megan. And Sally?
Yes. I'm Sally Wright. I am retired from Mount Hood Community College. I was there about 25 years in various roles, support roles. I have not. I'm not an advocate in the sense of I guess the community, for lack of another word. But my sister calls me a one-person humane society, because I think over my adult years, I have had something in the range of 20 to 30 animals share my household. And I have one of those unweaned kittens that is outlined in the flyer that I got from Animal Services, who is now going to be 6 years old. And I'm so grateful for that service. So yeah, I am retired and loving it. And I don't know how I ever survived not being retired.
Thank you, Sally. And Jay, do you want to introduce yourself?
Yeah, hi everybody. My name is Jay Levitri. I'm the Development and Communications Coordinator for Animal Services, and I've been in this role since August 2016. And I'm here tonight in a support role to make sure that this is publicly accessible.
Thanks, Jay. And I'm going to keep moving back and forth because I have my other monitor over this way, and I have the agenda open as well as a couple of the other things that we'll go through this evening. Did everyone receive the agenda in the email? And then Jay had also sent the outdoor cat trifold flyer that we want to talk with you all about. That came a little bit ago today.
Yes.
Great. So wanted to first do, and I'm just looking for the updated version of this. I know anyone who has been part of our world here at Multnomah County Animal Services for the last while. And honestly, even folks who are connected with any of the other partner agencies in the animal welfare world, or if you watch the news, have seen that there are some hiring challenges in the animal welfare industry. We are experiencing, even across our shelter coalition group, some challenges in hiring, especially in the areas of veterinarians and in the area of certified vet tech. And so we are working closely with our human resources partners on recruitment and hiring and have made some good hires. I am excited to announce we have hired a shelter manager. And so that's, if you look at our structure, there's me as the director, and then there's the shelter manager who is kind of has oversight over the operation, day-to-day operation, working with our management team and team of staff. And so I'm very excited. The candidate that we hired is actually moving here from Dallas, Texas. Her name is Marion Cannell, and she has been in the animal welfare industry since like 2012. She worked first at a nonprofit shelter organization called Austin Pets Alive. And I think the Pets Alive model is a national model. There are Pets Alive throughout the, but they always say what town they're in. And so she was at Austin Pets Alive. And then for the last several years, she has been with the Dallas Municipal Shelter as an operations manager. So she will start with us on October 31st. And very excited. She has great background, and as much as you can figure out about anybody, but I think in COVID, we've had to learn how to read and get a sense of who the humans are through the virtual modality. And she just really brings great energy even through that Zoom environment. So very excited to have Marion coming soon. And then we have made some hires in each of our in animal care and client services. So I think at the beginning of the summer, we had a number of vacancies in those teams. And so we have filled some vacancies and are still working to fill more. So we just recently had posted on the animal care team for animal care tech 1s and 2s. And we have a couple positions in each of those classifications. And our HR partners are scoring applications right now. And we got over 30 applicants in each of those two classifications. So I'm excited about that. We just hired another client services office assistant, and he started at the end of last week. So we now just have 2 vacancies on that team. So that's better than we were at the end of the summer. And are still working to hire one more certified vet tech. And I think you all know we've had a medical director position posted, which will be a combination of clinical, and that person, when hired, will do veterinary care as well as kind of the administration and management of our clinical services. That's being a hard one. We did receive one applicant recently. I'm reviewing her application, and we'll be setting up an interview panel to meet with her. If she's not our right candidate, then I think we'll work with human resources to adjust the recruitment and really hone in and recruit specifically for a veterinarian. That's where the significant need is. We certainly need the administrative and like kind of policy and procedure support in our clinical areas. And we can figure out how to do some of that administrative work, and we'll work to find ourselves a vet. And we have just one vacancy left in our field services office, a field officer 1 position. And so our dispatch positions are full, and all of the ACO, animal control officer two positions are also full. So that's on the paid staff recruitment and hiring. Questions there before I talk about volunteers? I know I talk fast.
Why, Erin, why is there a shortage? I know it's everywhere. I know it's at my vet's.
Yeah.
They've
Yep,
had to
it's
close
national.
weekends. Is it
Um,
lack of training? People just weren't able to go to school, or?
I think it's more, I think, in the area of people leaving the field versus young up and coming vets. There are still, like, I know there are people going through the programs at Oregon State and at other schools. But it's really manifesting as a very high burnout field, Sally. So I think what we're seeing is a lot of folks who are tired and who are leaving. And there's been an incredible amount of pressure during COVID, all of the, it's harder, I think, to navigate veterinary care in a virtual health environment. With humans, we all were able to do telemedicine appointments and it wasn't ideal, but it's pretty hard to do telemedicine with an animal because you can't ask them what's going on, right?
Yeah, that's true. That's true.
So I think that has been a big part of it. That's what I've read. I think then, and just like kind of with the great resignation in all kinds of fields, I think people are just exploring all kinds of other opportunities or taking early retirement. And so then you have fewer people with the training in the industry. There are more jobs than people. And so then you see, I think, private practice or some of the corporate folks being able to incentivize it in a different way. Recently, our classification and compensation folks in the county's central HR have done a salary review of our animal hospital positions, and they say salary wise, we're competitive with other like municipal shelters. I don't know how we stack up against like private, like Banfield or some of those larger vet clinics or that sort of thing. But I have recently talked with our HR folks to see if there are other ways that we can incentivize it. Again, in private industry, they're paying signing bonuses and some of those things. So and I think other managers as well in other parts of the county are raising those ideas. It's not a thing we've had to do because, in the public sector, our benefit packages are really good. But people are just trying to be more competitive. I've also talked with our HR folks. The Portland Veterinary Medicine Association recently did a survey of their members about what's important to them. And folks listed all kinds of stuff, one of which was salary, but other was things around work-life balance or health benefits or paid time off or like wellness benefits, like gyms or classes or that kind of stuff. And so I forwarded that to our HR recruiters because those are benefit packages that we do offer. And so maybe we need to do a more robust job of publicizing that. The other thing that I did in conversation with the HR partners, because we've had a fair number of candidates being interested, not both, in the director position, in the shelter manager position, and with this one candidate in the medical director position who weren't from our area. So weren't from like the Pacific Northwest or from Oregon, like I hired Marion from Texas. So I also asked the HR folks to do a little research and see where there are veterinary, especially shelter medicine programs, but veterinary medicine and CVT programs nationally, and to start reaching out to the VMA groups or professional listservs in those regions or connect with those schools so that we're like casting our net more broadly. Sorry, go ahead. other questions in that hiring and recruitment part before I go towards volunteerism? And then I think not just questions, but other ideas. You know, we're using LinkedIn, we're using Indeed. I think we're exploring even Craigslist and that kind of stuff. But if people have ideas about where, you know, directions we might go, super open to it. Okay. Volunteer outreach. This was an area that during COVID, when you know, we really had to scale back our in-person volunteers because folks weren't coming in to the shelter. I mean, not even all of our staff were coming in. And so we still had, during COVID, and still, we have a small group of folks who do some virtual volunteering, who actually help with our lost and found and like posting some of those reports. They work with Jay actually on some of the lost and found reports that we get. And so they're working on helping us upload things onto our webpage. And we have been bringing volunteers back in as potty walkers for mornings and afternoons, and helping with kennel cleaning and with laundry and feeding. And we are working on, there have been a number of volunteers, and that group is small but mighty. We're not kind of back up to where we were pre-COVID, but we are doing some really intentional outreach in some key areas of the shelter right now. And so reaching out to some volunteers who had helped with our admissions work before, helped with showing animals. And when we were just generally open to the public for walk-ins, they would help by like kind of looking and seeing in the computer, like which animals were available, or they could help with showing an animal if someone walked through the kennels and saw an animal they were interested in. They would do like a meet with those folks out in the yard and such. And so we're moving back towards figuring out how to be open for more, you know, to do adoption, more in-person adoptions and not just exclusively the online. And so before we get there, we want to kind of test out. We've identified between 6 and 8 volunteers who worked in that role before, pre-COVID, and are having them, we're starting like 2 at a time and coming in and having them work through the computer system. So we're doing training around privacy and confidentiality and how to access the data. And they're helping right now. We're starting having them help with adoption pickups and pickups from surgeries. So that folks are coming, instead of coming to the front door, they're coming around to the adoptions door that's to the side, that like side entrance, and helping then get the animals out and get them to their humans, either the newly adopting folks or people picking animals up from surgery. So we feel that that's kind of a progression. It's some of the same steps as helping to do in-person adoptions. So we're trying to slowly move in that direction. The volunteers really are what's going to help us with that capacity. Because while we have vacant staff positions, our like our animal care staff are focusing their days on you know, cleaning and feeding, kenneling, you know, all the animals in the kennels in the morning, and that takes several hours. And then we have folks who are dedicated to, we rotate through, who are doing admissions. So when strays are brought, especially stray dogs are brought, you know, to the front door, then we take them through the admissions door. So we have animal care staff who are doing those admissions. And then in the afternoons doing enrichment activities so that we're really able to work on socializing animals, getting, you know, being able to assess, especially dogs, but also cats that we're watching who've been having a hard time socializing with other cats or with humans. So we're doing some one-on-one enrichment when we have capacity to be able to have those animals have that human connection and be prepared as we list them for adoption or transfer or foster. So we're really, because we have vacancies in that animal care staff, it's been hard to kind of be able to, we have to meet those basic needs of the animals. And so then to be able to have staff to shift to the adoption piece is a bit of a stretch when we have vacant positions. So we're really looking at how can we use volunteers to deepen the bench. And I'm really excited at the work that Colleen O'Toole, our volunteer coordinator, is doing in that area. So we're, as I said, working first on folks who have experience in those areas. And then Colleen has been updating the job descriptions for all of those key volunteer roles. And so we're really looking to grow in a really robust way our volunteer pool. Questions there? Does that sound okay so far? It's like we're slowly moving to, I don't know, whatever post-COVID is, but it's not really post-COVID, right? It's whatever our world looks like right now. So if there's no questions, I'm gonna just go ahead and go down the agenda in the order that is on the page, if that's okay with folks. And I'll be watching time, and if it feels like we're getting tight on time, we can do some shifting so that I make sure and get feedback from you all in the areas that we're hoping to get some feedback, and then cover the areas you're most interested in tonight. Does that work for everybody? Great. So that's a beautiful cat. So in terms of the brainstorming ideas for increasing membership, and Dana also had sent an email, and hopefully folks saw that said she wasn't going to be able to make it tonight. And I think the idea, and we had talked a little bit at the last meeting, which was small but mighty. I think it was Sally, Dana, and me and Jonathan. And we kind of talked about this idea of really focusing that this group has been in flux, and that with all of the different directors and the change in leadership, or the several changes in leadership, that's really been hard, I think, to have a sense of the like focus and purpose of the advisory committee, and how to grow the membership. There's been some challenges in those areas. Does that sound right from where you all are sitting? So things that I heard in that last meeting are that it would be really great to grow the membership, that it would be great to do some outreach throughout the county and pull in folks who bring a variety of perspectives, whether it's from geographic parts of the county, whether it's from various kind of equity perspectives, perhaps looking at more diverse membership in terms of race and ethnicity and other lived experience. And that feels really important and valuable to me as well. That's work that I did in my former job with the county at Aging, Disability, Veteran Services. We had 2 advisory councils, and both of them, we ended up having to do kind of a reboot on both to really build councils that were reflective of our broader community and brought in diverse voices and perspectives. And also, work that we did with that group was to really hone in on the vision and purpose of the group, or the 2 groups, and to talk about gosh, this isn't a thing that happens to me often, but I'm at a loss the word I'm trying to think of. To move away, I guess, from like a Robert's Rule of Order kind of model to a consensus-based group. So I think those are conversations that I would love to explore with you all over the next several meetings in terms of kind of how the group operates. I want to reach out to the county's community advisory group to see if we can use some of the other advisory groups that the county to maybe push the ask for our membership. And maybe also ask like the partners in the ASAP network. So start to think about how we might draw more folks in. And then from there, the other thing that I really heard clearly, both at the last meeting where there were the four of us and the meeting before, and it was Jonathan and me and Sally, where we really talked about that what would be valuable, I think, for the members is that we really are, that if you're a community advisory group, that we're bringing y'all things to advise us on, to provide feedback on. So policies or procedures or things like that. And then it's not just a quarterly meeting where where I talk at you and you learn about what's going, but that it really is a true advisory group, that we're clear on the scope of the group, what policies and procedures and topics are within the framework in terms of you all to provide advice on. And that's a direction that I want to go as well. And so you'll see, like, we're testing that out this, with the outdoor cat information flyer. And I'm going to stop talking here because this really is a place too where I'm curious what y'all's thoughts are on, how that might go. I guess in some ways a cart and horse thing. Do we want to get clear with this smaller subset? With this, I think you all are the core membership over the last little while. Do we want to get clear on kind of the focus and purpose? And then grow it, or grow it and build it as we fly it? I've mixed a whole bunch of metaphors there, but I think you know what I mean. So thoughts from the group.
This is
If no one else is
Christine.
going to talk.
Sorry. Oh,
No,
sorry.
please go ahead first. Go ahead, Christine.
Well,
Thanks, Christine.
I mean, I think it's a combination of those things. I think they build upon each other layer by layer. I think having a sense of purpose and having that bidirectional feedback, like, you come to us needing feedback, but then you then show us how that was used, kind of getting that feedback loop going. I think that'll build out the purpose in a way that makes it easier to recruit members. And then layer by layer, I think those will feed off of one another. And certainly including accessibility practices, having statements like DEI statements. I geek out on that stuff during the day, so we can geek out on that together sometime if you would like.
I would love that.
But yeah, I think it's a combo of the two. I think having like the ask today to provide feedback, that's exactly, I think, what this group is capable of doing. And then if we see changes implemented, then that's, fulfilling, rewarding, and then that'll help grow the group. That's like a long-winded way of saying both.
I'm totally down with the both and concept. Thanks,
Yeah.
Christine. Jonathan.
Oh.
I just thought you had something. I can't.
I do. Can you hear me?
I can. Yeah. Thanks.
Okay. So at various points in time, I was actually just looking back through my emails. I had reached out to the committee shortly after the chair position was established, and was trying to basically take the pulse of the committee. And I think if we wait too long to recruit, like most of the people on this committee are going to be term limited out before we actually get somewhere. At the same time, retention, honestly, I think retention is an issue of the committee itself having no true function.
Mhm.
I think people, from the feedback I've got from people, it is that they basically they don't feel like we're being utilized to actually accomplish anything. And I know I said before, a lot of that is because every 9 months we get a new person to come in here, and then it's 6 months of getting to know them and them getting to figure out their feet, as a new person there. But like, in some ways, the committee almost just needs to be rebuilt, and with a foundation that is actually going to make us a valuable part of the community, so that we're actually doing work that is, I don't think that the purpose of the committee solely should. I mean, the reports are good. That's the kind of thing I'm interested in. But some of the feedback is like people thought they were going to be able to go out in the community or share ideas with the community or try to involve the community. And for a lot of people, just hearing PowerPoint presentations isn't very rewarding.
Mhm.
I just think there needs to be some depth, and we can recruit all the people we want, and people are still going to just turn around and leave if that 6 months down the road they just feel like they're not accomplishing anything. That makes sense.
It makes total sense.
I could probably honestly go on for an hour, and I don't want to do that right now, but I just think that from all the feedback I've gotten from everyone is that I think there's a lot of frustration, and a lot of desire to do something. People want to help, they want to contribute, and they just don't feel like they have an avenue. There was always a saying, oh, well, you guys can do this project or that project, and it just kind of never goes anywhere. And I think the committee needs a foundation, a solid direction, and to be empowered to actually accomplish things within these meetings and then without. And how we go about that, I'm not entirely sure. We decided to move to this chair position stuff that still needs to get sorted out, and I think those are basically hand in hand. I just think it needs a lot of love right now.
Mm-hmm.
And I'm sure other people could probably comment if they so choose. But I'm just trying to channel what I've gotten back from a lot of different people. But we can also have a conversation offline at some point if you want about all of that.
That would be great, Jonathan. I would really appreciate that. And I would be more than happy to set up, one-on-one check-ins with each of you, if that's of interest. So to kind of gather some of that same feedback.
Yeah, I definitely echo what both Christine and Jonathan have said, and kind of on a similar tip to what Jonathan was saying about the expectation of folks being able to do things. Definitely echo that piece about wanting to be able to do more out in the community. And this might be unpopular, but I know for me personally, it would be just a huge boon if there was a way that we could do any sort of meeting in person. I don't know about you guys, but I sit on phone calls all day long for work, and by 6:30 on a Monday, it can be hard to kind of tap into the energy that I want to bring to this. So I think it would just be really efficacious for me if there was at least a mix of some sort of in-person component. I think that would help really, I don't know, just kind of crystallize things, and I think it would help in the rebuilding effort if we were able to get in a room and just kind of talk some of these things out. I know that for me, I think would help really kind of deepen the connection and the work that we do in tandem with all of the great comments that Christine made about, rebuilding and recruiting, and that Jonathan made about just, larger feedback you've gotten. But that's something that definitely has been missing for me.
I just want to add to that the last interim director, we were supposed to be back into at least blended in-person meetings 3 meetings ago, so almost 9 months now.
Okay.
So that that was something that I specifically brought up several times, because these meetings just as someone who actually used to sit in the room and have these meetings, it just doesn't compare also. So blended, however it works, but I really feel like the basic structure of this meeting should be in a physical location in a room, and then people who can't make it can join via the WebEx or whatever. I think it's truly important to have that energy where you can go around a room and talk with people, and it's not, it's a lot more personal.
Totally.
Thank you. That was actually going to be one of my questions around virtual, in-person, hybrid. Sally, any thoughts in this area?
Well, I was actually digging through some of my information to see if I had a copy of all the work that we did on the bylaws, and the committee structure, because I have kind of forgotten those. We did some very, very good work. I think everyone was pleased with it. But in that process of space, between meetings and not having actual responsibilities, I was thinking, well, where are my bylaws? What is it that we really are supposed to do? I mean, a thought I had, just kind of a crazy thought, was maybe those bylaws need to be on every meeting announcement that we sent, that is sent out, just so it's there, and we go back and say, okay, what is it? What is our charge here, and how do we get to that point? I think also I joined right as COVID was starting, so I have never met anybody in person. Although I have been very pleased to, continue in Zoom and have that relationship. I have mixed emotions, meeting now that it's getting, dark early and driving and the location and that. But I certainly, if that would make a big difference, and I think it would make a difference, that I would put any concerns aside and say, okay, yeah, I'll be there.
Thank you.
Mhm.
Have any of you been part of this group long enough that you were going to the meetings in person, and where were they? Does anybody know?
I think I may be the only one left. They were at the Multnomah building,
Okay.
on like the Grand or MLK or whatever.
Okay, on like that first
It's
floor
just-
meeting room, like 125.
Like Hawthorne?
Yeah, Hawthorne and Grand or whatever.
Okay.
Yeah, they
Okay.
used to have one of the conference rooms there we used.
Okay.
I just wanted to add real quick.
Mhm.
For us to have any effectual change, I feel like these things can't go 3 months apart without being addressed. I feel like there needs to be some serious engagement on solidifying the base of this committee and getting that sorted out.
Okay.
So at the very least, that we can start recruiting by our next meeting.
Okay. What would that look like for you?
Well,
Like another meeting of the whole group in a month?
Yeah, see,
Monthly for a while?
I don't know. Maybe that's something that we could talk about.
Sure. I
Or if
will.
anyone else has any input, or I'm just saying, I just don't feel like we're ever going to get anything done only meeting 4 times a year when there's so much that needs to be structurally changed. Does that make sense?
Thank you. Okay.
Jonathan, I'm just curious because you're the longest standing tenure in this. If there's been like a marked difference, like if there was a time where you felt like the what am I trying to say? Like the duties and the mission of the group were more tangible and like more fleshed out. or if it's just been kind of like a long-standing something that could be improved. I'm just curious if there's something to benchmark and like compare it to. I think all of us who joined in COVID have all just had this like kind of quarterly version. So it's kind of part one of my question.
So I joined the committee with the ladies who were term limiting out, who were the founding committee members, and their feedback would be kind of like mine, probably less so for you guys. I've had at least the ups and downs of feeling, value and then in the drought of new directors, and they said in their time, so over their 6 years, they had times when they felt really engaged, like they were able to do a lot of things, and that was one director. And then another director came in and then basically felt like they basically lost half the committee, because the committee basically felt like people just felt like they were wasting their time. And so this is a cyclical thing. It's been there since probably the very beginning. I think it's foundational.
Okay.
So
like
maybe that's it.
Yeah, no, I was thinking, I would just like, if there was like a time we could refer back to say, hey, things worked really well when it was X, Y, and Z, then I would love to be able to be a part of that and like try to kind of do that revamping. But we don't know what we don't know, right? Since so many of us are new to this, so it kind of sounds like, and like this is me just kind of speculating based on what you've said, Jonathan. It kind of seems like the efficacy of the group, it's really top down. It's really kind of how leadership like elects to use us. So it says, Aaron, like you have nothing else new on your plate right now. It kind of seems like a lot of like I don't know, like I think about how could we be really effective, and I just like I don't know the answers because I don't know what else is out there that we could give input on. So
so I think this is no offense to you, Aaron. I think that and I don't know how this works, but I don't know how the committees work for the county and all that stuff, but at some point or level, like the committee itself needs to be empowered, and I don't think a change in directors should be able to derail or fundamentally alter the committee's purpose or mission.
Yeah.
And that's of course above my pay grade as far as how all that language works out, or if that's even feasible, or if there are ways that we can work within the guidelines that the county has for committees that still leaves the committee. I mean, in theory, the chair of the committee is supposed to be able to set the agenda and all that stuff. That is supposed to give us, some of that option. But longer term, I don't know if even that would, if the next director comes in and just doesn't want to do, half of the things that we're working on. So I'm not even opposed to like redoing the bylaws, redoing the charter. Maybe it really just surely needs to be rewritten, reformed, new mission, new purpose, and maybe one that just empowers the committee itself a little more, or maybe a little more clearly, I guess. And I'm probably not using the words quite correctly. I'm trying to think really quickly, but does that make sense, Aaron? Anything you'd say to that?
It does. Yeah, no, it does make sense. And I will commit this week to reaching out to you and finding a time where you and I can connect. And then, about some of like this meeting scheduling and, if we can pull something together sooner. I hear what you're saying, Jonathan, about it's really hard to do a reboot and focus and, membership outreach and all of that stuff with quarterly meetings, especially when it's been kind of so in limbo, which it sounds like it's been for a while.
And I know that not everybody on the committee has time always, but if we're going to do like a major structural change, maybe it's a thing where a few of us can actually meet and sit and find a room somewhere that the county can let us use, official, non-official. I don't know exactly that. Yeah, I think if there's more than half
Right.
of us, then it has to be recorded, right? But if it's just a few of us in a room trying to flesh out a new, operating guidelines or something, I don't know. It just if
Mhm.
we
I think
need to
that's
get some
possible.
input, and I just
And-
don't know how else to make this better with it the way it is right now. And
Right.
so maybe when we talk, you probably have a lot more ideas because you've done a lot more of this than I have. But
How does that sound to folks for a plan? For Jonathan and I to meet and kind of noodle on some of it and then bring something to the group to respond to not waiting 3 months.
Sounds great.
Okay, great.
Be open to it. Yeah.
sorry for going on for so long.
No, you're fine. It's great. I appreciate the conversation and I asked, I want to know. And connecting with the community in a number of ways, including in partnership with an advisory committee, is really important to me. It's a value that I bring to this role. It's a value that I have had as long as I've been in a leadership role in the county. So whether it's with older adults and people with disabilities or with families that are comprised of humans and animals, that value doesn't change for me. So these are conversations that I want to have, and it's work that I want to do in partnership with you all. So, and that doesn't mean it's going to be easy. Reforming a group is challenging, and it's valuable.
For me,
Go ahead.
is being on my lap. Like if I don't accomplish anything on this committee, besides leaving at the end of my term limit, as with this committee functioning and having a purpose going forward, that is my goal. That is the one
Okay.
thing I want to see before I leave, and I'm committed to putting as much time as effort as required to see that through.
Great. Let's do it.
Back you up.
Beautiful. And I will also look for, or I'll work with Jessica to look for an in-person option that maybe has the hybrid technology, like one of those owls or something, so that if folks aren't able to, especially in the evening meeting, moving into winter, there are some barriers there. And I get it. I'm a relational human, and so would really love to meet you all in person and sit in the same space at some point, if that's possible. But I'm happy to look for something that would meet our needs, both in terms of physical space and technology. Because sometimes hybrid meetings can be hard too, just because you can put somebody's laptop here, but you just don't get all the people. So I want to find a way that it really feels inclusive and creates opportunity for connection in whatever way folks are able to participate. Does that sound all right?
One thing, I know that I think most of the committee or all of you are working, so probably the 6:30 time is about the best time to get together. But I might throw out the possibility of getting together earlier, particularly as we go into the winter hours. But I just throw that out. I'm just one of the group, and like I said, I will be flexible and I'll be a big girl. I'll go out at night.
So
It's amazing how you can
previous-
retire and you don't want to go out at night.
Previously, when we were meeting in person, I think that the director and their assistant usually showed up half an hour or an hour early or so. Another county provided us lunch or whatever,
Yeah.
a snack or something.
Yeah.
But they showed up early so that people could talk and have a chance to relax and unwind.
Mhm.
But I think the thing about the time is most people have to work, and it's difficult to get across the city sometimes. But
We can also do, just a little survey of some sort to get a sense of people's availability as we explore all of these options. So it sounds
I'd
like,
also be curious to see
oh, go ahead.
where folks are located. We don't need to name it now on public record, but in the survey, maybe we can find a location that doesn't feel so far, so daunting.
Right. That's a great idea, Christine. Jay, I'm sort of hoping that in notes you're capturing some of these things that I'd love to work with you and or Jessica, and maybe we can do like a little Survey Monkey or a Google survey or something to try and capture some of folks' availabilities in terms of like day of the week, time, and maybe location or region of the county.
Yeah, definitely. And I've taken notes on the feedback that the group has provided,
Awesome.
changes they would like to see implemented.
Fabulous. Thanks, Jay. We okay on that topic for now? I want to be mindful. This is just buzzing right along. It's already almost 6:30. Some of that is because it took me 3 extra minutes to get logged in, but so I'm going to do just a couple of the next 3 things are more of those update kind of things. So I'll give an update on the veterinary services voucher, that contract pilot that we're working on. We're working on a wildlife pickup contract and some current work that we're doing with University of Wisconsin. So I'll like do an update on the thing and then see if there are questions and then do the next thing. And I'll try and move through those fairly quickly so that we have, I'd like to spend at least 10 minutes or so looking at the flyer if you have time, if we do this work right. Does that sound okay?
Good.
All right, so the veterinary services voucher contract, it's a pilot program. As I discussed earlier in the recruitment and hiring and the volunteer work, we're really trying to look at creative ways that we can deepen what I'm calling deepen the bench. So find like short-term help or ways that we can just do things differently so that we're able to really focus on meeting the needs of the animals that are in our care and really trying to create pathways and like move animals forward to particularly transfer and adoption as quickly as we can. I mean, I think everyone who works in the animal welfare world knows that length of stay is a thing that matters, and the shortest amount of time that we can have an animal physically in the shelter, that's the best for the animal. And so one of the challenges that like was on my plate really from day one, July 1st, 2022, is that we were seeing animals kind of backed up in the queue in their ability to move forward to being fully adopted. Our capacity in the veterinary care area was being an issue, and that's because we only have so many hours in a day or in a week that our veterinarian. Right now, we have Dr. Megan Romney, who's been our veterinarian for a number of years in the teens. Dr. Romney's been with us, which feels like that means she came here when she was a teenager, and I'm not sure how that's possible. But so Dr. Romney is our one veterinarian on staff, and then we have 5 or 6 vets who are working for us on call, and they each pick up maybe 1 or 2 shifts a month. So it doesn't give us a ton of extra capacity to be able to do like key veterinary functions, which are like follow up on regular medical conditions, things that the animal care staff identify, and then to be able to do surgeries, primarily alteration or spay and neuter surgeries, because it's been our historical practice, and it's obviously a best practice that we send animals out into the community that have been altered. Oregon Humane Society, most of the other shelters, it's the same thing. But we have had limited capacity to be able to do that in a timely fashion. That's even with them like doing huge numbers of surgeries a day on the days that they do surgery. And so we reviewed our ordinance with our county attorney. And the ordinance does not actually require us to make sure that an animal is altered before it's adopted out into the community. And so we started exploring how could we make it happen, the alteration, and be able to move animals forward so that they're not like, backlogged in the shelter or kind of hanging in like this in between space. And so we are working with the counties, with our Department of Community Services contracting folks. And we've identified at this point 3 veterinary community vets, and there's a possibility of 3 more. They just haven't been following through as quickly as the first 3. And these 3 veterinarians are going to contract with us. So we're going to adopt animals out and provide the adoptive families with a voucher to go to one of these 3 veterinary clinics. And the clinics will take the voucher and they will spay or neuter the animal, cats and dogs mostly. And then they will bill us for that service. And so it's not going to be our ongoing practice to do these vouchers. But it is what we're going to do right now while we're short enough vet hands to be moving animals along. And then periodically, once we have these contracts in place and we're caught up in our surgeries, as well as our, just general vet care follow-ups with the animals in the shelter, then we would have these contracts in place so that we could intermittently, like during kitten season, we might, as we're focusing on kittens, we might, go back to the contracts or whatever. But so for right now, we are working toward, and we're very close to having the contracts finalized. So right now we're adopting animals out and we're letting the adopters know that we will be following up with the actual paper voucher as soon as the contracts are signed, and then they'll be able to go to those community vet clinics. We are keeping a spreadsheet of everyone who's adopting an animal that's unaltered and that we have a voucher coming to them. But it's just a way for us to be able to have animals not kind of held up in that kind of in between space so that we can get them into a home and community setting with a commitment for the alteration surgery. I was going to describe that quicker and I didn't. Questions on that pilot project?
So the feeling, and that's not really the word I should use, but the goal or the feeling is it's more important to get that animal out of the shelter and into a family
Yes.
and run the odds of that animal getting spayed or neutered.
It's a calculated risk, but yes. We really do feel like it's in the best interest of the animals to be in a home setting versus in a shelter. And if we can, move animals into a home setting, it also lets us reduce the number of animals in the shelter, which then also frees up our veterinary time. So if we are holding animals, it keeps our population higher. And so then that can impact length of stay and it impacts veterinary capacity. So it becomes just an all around conundrum. So we do feel like this is kind of at this moment in time, the best case scenario to let us move animals quickly so that we can then increase our surgical and veterinary capacity and reduce our population in the shelter. Other thoughts or questions? We are still doing some alteration surgeries. So for example, if we have an animal in our care that rather than go to an adoptive family, they're going to like one of our transfer partners, like, you know, there are some breed specific rescue agencies and that sort of thing. And many of those agencies won't take a transfer unless the animal's been altered. So we're prioritizing those. We're prioritizing rabbits because often community vet clinics won't do alteration on rabbits. We are still doing alterations on younger cats and kittens because some community vet clinics don't have the expertise that our vet does in doing the alteration on kittens. So we're still prioritizing certain ones or looking at capacity. Other questions or concerns on that particular one? Seems okay and well and thought through.
And will you probably also track, or can you, or will you track? Well, you will, because you'll be
Yes.
billed, but to go back to the
Yes.
adopter and see if they have followed through.
Yes. Yeah, we're gonna send reminders out. And what we've done is when we have the contracts fully signed and the vouchers printed, they're going to have an end date on them. And so we'll be tracking against that. And so then we can do the reminder that says, you know, your voucher is due to expire. So I really encourage you to get in. So we are going to be monitoring that.
Do you, I mean, I think, I don't know how you would do this, but having a animal spayed or neutered, particularly spayed, is expensive. And is there some way to let the adopter know, hey, you know, we're giving you this $300 gift, something that says it's not just something we want you to do or you need to do,
Right.
but this is what it would cost you if you don't utilize or something like that.
I think the way that we're framing it for right now, Sally, and that really is a good point, is that we're balancing it with the fact that because we have, you know, a good number of animals in our care right now, and we're really motivated to get as many adopted out, you know, so we're still waiving the adoption fees, and so
Yes.
we're letting folks know that you know, this is part of, in essence, this is another fee that you wouldn't incur because we're providing this certificate.
Yeah, yeah, yeah.
Thanks for the
I want to
questions.
say, and this might be showing my age a little bit, but I swear I remember a time when I adopted a cat from Oregon Humane Society when they were giving out vouchers. I think maybe before they built the hospital.
Oh,
I could be misremembering. Could have been somewhere else. Maybe it was
no,
Washington. Either way, I've gotten a voucher before. It works pretty well.
great. Thank
Yeah.
you. And we did check with some of the partners in the network. And so
do
we
it.
talked with leadership at the Oregon Humane Society and said, this is what we're doing because we just feel like we have to because we have some capacity issues. And Sharon and team said, you know, we would do it too. We feel like that makes sense, that it's a thing you have to do right now. So that actually is very reassuring, Jonathan. Thank you. Another area where because workload has gone up and our staffing has been somewhat restricted, although, as I said at the beginning, we have filled most of our field officer positions. We're working on another special contract for a deceased wildlife pickup contract. It has been a service that we have provided in the county for a number of years where the community has like called in and say there's been like a raccoon or squirrel or an animal that's been hit by a car. And so there's deceased wildlife in the road, and the community has been able to call, and we've sent field officers out to pick up that deceased wildlife and dispose of it. We've been really stretched in our ability to do that. And because at the same time, while we have those calls coming in, we've also seen an increase in animal cruelty and abuse and neglect, and stray numbers have gone up. And so we are having to prioritize those kind of health and safety calls as we look at the time and capacity of the field officers. So if we're prioritizing those animal welfare, health and safety calls, we have really struggled to be able to do those deceased wildlife pickups. They're not a thing that's been required in our ordinance. And so again, we went to our legal counsel, and we went to county elected leadership and talked about other solutions. And so we did a very limited, we pushed what's called a procurement out. So where agencies who do this kind of work, like picking up deceased animals or deceased wildlife. So we are doing a 2-year specialized contract so that, again, we're going to be able to refer those pickups out to an agency that will contract with us. So we'll be able to meet the community need to get the deceased wildlife out of the road, but be able to focus the time and capacity of our animal control officers to being able to focus on the health and safety of, you know, cruelty, neglect, abuse, those cases. So that is, again, a bit of a shift, but as we're looking at creative ways that we can respond to community need and maximize the time and energy of our staff on the most critical core functions of Multnomah County Animal Services, we are very close actually to having that contract signed and that service in place. Currently, if you go on our website, you will see that we're teaching members of the public, how someone, like if there was a deceased squirrel, something on the street in someone's neighborhood, how they could safely remove it and dispose either at the Metro Waste Station or in their own trash. And so we have provided instructions on how to do that. And that really is just a bridge thing until we have this contract in place. So that's a different thing that we're doing as well. Questions on that one?
I'm laughing because my Carolina healer would love to take care of all those squirrels that are on.
Oh, yeah.
But,
Yes, my little dog would, love to. He thinks he thinks he could get all the squirrels in the neighborhood, and he considers their existence really a personal affront. Actually, sometimes when we're on a walk and he wants to go one way and I'm ready to go home, I'm not gonna lie, I will say, "Hey Vance, is that a squirrel?" And then he goes this way so that we can head towards home.
it
And
works.
then I give him a treat.
Yes.
So, all right, I want to be mindful of time. It's 7:45. We're scheduled to finish at 8. I can do, I swear, I promise, a very brief talk about what we're doing with the University of Wisconsin, or I can table that till the next meeting, or let's do this. Let's talk about the outdoor cat, about the flyer. And then if we have time, we can talk about the University of Wisconsin, our process mapping project that we're doing with them. Does that seem okay with folks? Okay. So I'm going to ask a technology question. Have you been able to look at the flyer, read through it? I mean, I have the luxury of 2 monitors, so I have it up on my monitor. I don't know, we could also, my guess is that Jay could share his screen and put it up there. What's folks' preference?
Well, I had a chance to review them before the meeting started, and when I brought them up, uh, and I didn't have the visual of how it would be a trifold. I just had the information.
Text,
Um,
okay.
I did find, part of the jobs that I've had through my life was doing the proofreading and making
Mhm.
sure that, and I did find a few little things. So I did ask Jay to send me the PDFs that I could
Okay,
actually mark on, just for those kinds of things.
great.
And I believe he's done that. So I don't know what everybody else got, in what form, and it could have just been me to get it in a big old PDF. But my question is who and where are these going to go?
Oh, look at you, Jay, thanks. Um, so, and Jay, maybe you can help me answer that question. I know we'll have the trifold, the flyer will be in our lobby area. We will also be sharing it with, the animal welfare, partner network. We have the information up on the web. Um, other places, Jay, where else does it go? Dear.
Oh, sorry. My
No, that's okay.
controls moved with that screen share. So this is really intended to be a resource for the community. Um, so we have a version on our website of things that we'd like you to do if you do find an adult cat, and also kittens, and those are separate. We had seen an example shared by the University of Wisconsin of what Chicago Animal Care and Control was doing, and we liked their example a lot. And so we decided to make kind of our own version with our own local resources. So we tried to boil down what we had online and put the most important information about both adult cats and kittens into a single flyer, just because we have had a big paradigm shift on what we're doing with cats. And these changes were recommended by the National Animal Care and Control Association, but I believe the actual policy and guidelines were drafted by um, a doctor named Kate Hurley, who's with UC Davis. Um, in the industry, she's actually been instrumental in most of the changes that have been made for cats and a lot of other shelter medicine changes over the last 10 years or so. Not without controversy, it is a big shift, but they found that I think you reviewed the policy before, but we just wanted to provide a more accessible version of it for the public. So this would be carried by our animal control officers. It would be at our front desk. You can download and share a version of it online, and we're just trying to get it out there as a resource for, you know, what is the new way, and how do I make the nuanced decision of when to take a kitten and bring it to the shelter, or when should the kitten stay with their mother, and when is an adult cat,
Thank you, Jay.
sick and in need of help.
It's beautifully done.
Oops.
Yeah. Jay's awesome, not gonna lie.
And they're two different. There's the outdoor cat resources, and then there's specific to kittens, right? Or is it just a flip side?
It's a flip side,
Oh,
isn't
Yeah,
it?
this one it's a flip side. So what you see on the right would be the cover,
okay.
and then the center would be the back, and then on the left it would be the inside flap.
Lap, okay. Okay. Oh, it
And
is.
this down
Okay.
here would be, yeah, this would be the entire inside portion of
I
it.
see. Okay. Yeah, it actually came across, I think, as two different. Okay. Okay. That's beautifully done. Well, I still like to mark it up.
We brought it for feedback, Sally. Form and content-ish. Not total formatting, because it's.
No, 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 no. Just, just where you got an extra space and,
Yeah.
those of us who have done proofreading, just, kind of pick up on those things.
Thank you. Others? Questions or comments?
Very nice. It's very pretty.
Yeah, this is great. I have a couple of questions.
Yeah.
One is there a plan or resource or budget to increase language access, like have this translated into other languages? Has that been offered before? Of interest?
I actually, in my short time with MCAS, we just started having conversations about translation. We just translated an internal form. And I am fully supportive of us working with translators to make this kind of information accessible in other languages. So I think we'd probably start with Spanish and then, explore to the other, again, in my former job at Aging Disability and Veterans, we were translating into a number of languages. So
Excellent question.
I would be happy to work with Jay and our team on what that might look like.
Yeah, and we do have a translation provider that also works with Multnomah County elections, and they are really good. We translate everything on our website, well, the main pages, into Vietnamese, simplified, Chinese, uh, Spanish, and then what was the other one?
I bet Russian.
Russian. Yeah.
And we can do the same with written forms and flyers that we're distributing.
Awesome. I think that would be great for this flyer because certainly everyone is running into cats and
Yep.
kittens out in the wild. My other question or suggestion would be if a similar or exact flyer is going to be posted on the website for folks to print or use. I talk a lot in my day job about accessibility and like folks who may be blind or low vision or using screen readers. And so I skimmed it with my highlighter. It is somewhat in order, but I would suggest having a non-trifold version to download for folks to access if they need digital access. So I feel like I'm coming in with all these things.
No, I think that's great. And Jay, one of the things that I can do is share with you work that we've been doing in ADVSD and the county's Office of Diversity and Equity. One of the folks there, Ashley Carroll, has been doing a lot of work on accessibility from that perspective that you're raising, Christine. So I think we can also look at, I'd like us, maybe we can pull some of that information in so that we look at our printed materials and website, and also think about things like accessible meetings. So thank you. Other questions and feedback? And you have it in your email now. So if you, see something or you need it in a different format, we are open to the feedback. And I want to thank Jay for his hard work on this. It's really great.
It's beautiful. It's really beautiful.
Yeah, super happy with it. I want to be mindful of your time because it's 7:56. I don't know that I can cover University of Wisconsin process mapping and community engagement project in 4 minutes. So I think what I'll do is carry that over And because it's possible that we might meet before 3 months, especially after Jonathan and I connect. So, or I'll see if there's a way I can give a written update on that to the group. So I get for the last 4 minutes, I am open for questions. I think and comments, and I can also think action items that we have are, I'm gonna schedule a time to connect with Jonathan. I'll reach out later this week and see, we can do that kind of back and forth and find a time. And we can do a little teasing together of what next steps might be for the group. We're gonna work on a survey about time, date, place that might work for folks. I think those are the two big action items. Is there anything else? Either Jay from the notes or folks from your recollection of this last hour and a half together?
We actually gave you some feedback. That feels good.
It feels really good.
Feels very good.
Jonathan suggested a recruitment before the next quarterly meeting. I'd be happy to support that effort whenever
Okay,
we're
great.
ready to begin and consider places to recruit.
Perfect. Thanks, Jay. So Jonathan, that can be on the agenda for you and I to discuss in the next couple of weeks.
I mean, in a perfect world, like we should be recruiting right this minute. But I also feel like if we don't work out some of the structural issues, it's not
What do
going
we
to
have
have
to
the same
sell?
impact.
Yeah.
Yeah.
Oh my, Christine, what a cutie.
You can't have an animal shelter meeting without showing some animals.
That's
This
right.
is Dolly. We adopted her at the shelter right before the pandemic, so she just knows this life of mom being at home. Yep, just thought I'd share.
Cutie, thank you.
She's being bashful.
She's darling.
I have my unweaned kitten is spread out on the desk. She was the
Delightful.
one that she and her sister were found as unweaned kittens and taken to the shelters. They were 8.5 ounces when they arrived.
So did they come to you as bottle babies?
Well, I didn't adopt her until she was ready. But
Okay.
that's kind of a story in itself that I marched right down there on Christmas Eve day and I said, she's not spending Christmas in the shelter. She came
Oh,
home. So,
that's sweet. That's really sweet.
so she's here at the meeting,
Excellent.
sleeping.
Well, I have a particular fondness. We have 2 ferrets on the shelter. At least we did when I left today. They are so cute. I've never been around ferrets and they're darned cute. So they're
Fun.
serving their stray hold right now. And if you know anybody who's interested in ferrets, they're really cute and sweet. It's 8 o'clock. I want to thank you all for your time this evening and the conversation. I feel like it was really valuable for me and I'm grateful for your service.
Thank you. Nice to have you on board.
Thank you. I'm excited. All right.
Thank you. Congratulations on the permanent position.
Thank you. Thanks.
Position.
Yes.
It's a big job. I keep saying that every day. It's a big job, but I'm excited.
Good. Thank
It's
you.
good work. Yeah. All right. Take care all.
Okay. You'll be in
We're
touch
out.
with us then.
I will be in touch with you. I promise. All right.
Thanks, everyone.
Good
Thanks.
night.
Bye. Thank you.
Night.
Named me